not to extend minutes.
Without objection.
Mr. President, in this morning's Washington Post, we have once again an outstanding article by Robert Samuelson, this one entitled, "Healthcare Nation, Medical Spending Threatens Everything Else." Mr. Samuelson has been critical of Republicans, and he is in this article. He's been critical of Democrats, and he is in this article. But he makes some points that I think are worth bringing to our attention. The primary one being that we are not focusing on the right thing, which is making some kind of attempt to turn the cost curve down, using the budgetary doublespeak, with respect to health care. Let me quote a few comments from Mr. Samuelson's presentation. He says, first, the most obvious characteristic of health spending is that government can't control it. A very true statement, which I will show in just a moment, is demonstrated by our past history. He goes on to say, the consequence is a slow, steady, and largely invisible degradation of other public and private goals. Historian Niall Ferguson, writing recently in Newsweek, argued that the huge federal debt threatens America's global power by an inexorable reduction in the resources for the military. Ferguson got it half right. The real threat is not the debt, but burgeoning health spending, that even if the budget were balanced, would press on everything else. Everything else includes universities, roads, research, parks, courts, border protection, and, because similar pressures operate on states through Medicaid, schools, police, trash collection, and libraries. Higher health spending similarly weakens families' ability to raise children because it reduces households' discretionary income either through steeper taxes or lower take-home pay as higher employee-paid premiums squeeze salaries. He concludes, Obama talks hypocritically about restraining deficits and controlling health costs while his program would increase spending and worsen the budget outlook. Democrats congratulate themselves on caring for the uninsured, who already receive much care, while avoiding any major overhaul of the delivery system. The resulting society discriminates against the young and increasingly assigns economic resources and political choice to an unrestrained medical industrial complex. I ask unanimous consent that the entire piece be printed in the record, the conclusion of my remarks.
Without objection, it will be included.
Now, to demonstrate the accuracy of what Mr. Samuelson has to say, I have some charts. This one shows the breakdown of federal spending in 1966. Why do I pick 1966? Because that was the beginning of the year, that was the year for the beginning of Medicare. At that time, 26% of the federal budget went for mandatory spending, overwhelmingly Social Security. 7% went to pay interest on the national debt, and 44% went for defense, with 23% for non-defense. Where are we now? In 2008, mandatory spending had more than doubled and had gone to 54%. Interest costs remained about the same, 8%. Defense had shrunk to 21%, cut in half, and non-defense discretionary 17%. The difference? Medicare and Medicaid, taking over the mandatory side. Now, what do we see as we look out in 2019? We can't break down the difference between defense and non-defense because that would require an analysis that's not available to us in that future year. The mandatory by that time will have grown to 61%. The size of the debt, increasing costs now, interest costs have grown to 10%, and defense and defense discretionary have shrunk to 29%. A complete reversal. That's roughly what mandatory was when Medicare was started. Now, I'm not saying we should not have Medicare, and I'm not saying we should not have Medicaid, but I am saying we should be focusing on how we make people healthier, how we reward people for not using the system, how we do something to control the costs, instead of increasing the status quo with respect to health care spending. And this chart was drawn up before we had the bill before us. I think it's very likely that if the bill before us passes, this mandatory will grow even further. And we find ourselves in this situation with respect to 2010. I watched the budget as it came down, and it said in 2010, federal revenues were going to be $2.2 trillion. And mandatory spending was going to be $2.2 trillion, which means that every dime of everything else had to be borrowed. I worked with Senator Wyden and a number of others on both sides of the aisle to craft a health care plan that would turn the cost of health care, turn the cost curve down. We didn't even get a vote in the Finance Committee. We didn't even get anybody to consider what we had to say because everyone was focused entirely on the issue of let's cover the uninsured. And the position is let's cover the uninsured by taking what we're doing now and spreading it even wider. And as Mr. Samuelson says very clearly in his column today, that squeezes out the money for everything else. That is an uncontrolled expenditure. We're not focusing on changing the system in a way that can cause cost curves to come down. We're just focusing on taking the present system and spreading it wider. Now, the cost curve can come down. I've quoted this before. The Dartmouth study talks about where the best health care is available in America, and it's in 3 cities, according to Dartmouth: Seattle, Washington, Rochester, Minnesota, and Salt Lake City, Utah. And then they go on to say if every American got his health care, his or her health care in Salt Lake City, Utah, it would be the best in the country and 1/3 cheaper than the national average. 1/3 cheaper than the national average, because the focus in that plan, as it is in Rochester, Minnesota, and the Mayo Clinic and other places, is trying to make health care better and therefore cheaper, instead of focusing on taking the present system and perpetuating it. If we don't get into that mentality, if we just take the present system, which this bill does, and spread it over a wider number of people, which this bill does, we will see the spending go up, and we will see everything else suffer as a result of it, and the health care will not get any better for the people who are involved. Now, Mr. President, I see the senator from Iowa wishes to ask me a question, and I'm happy to respond. Tell me how much time I have left, and maybe some of it will have to come off of him.
Senator has 2 minutes remaining.
In my 2 minutes, unless it's a long question, I'll be happy to respond to any question the senator from Iowa may ask.
Well, I thank my friend from Utah. I would just say that a lot of what he says I agree with. That's why in this bill, and I keep reminding people, it's not talked about much, but there are more provisions in this bill to promote wellness and prevention than any health bill we've ever passed, ever in the United States Congress. There are huge investments in this bill on prevention and wellness. And I happen to think that perhaps one of the reasons Salt Lake City is so good is because people don't smoke, they don't drink. And that sure goes a long way towards providing for healthful living. So I say to my friend from Utah that if people talk about bending the cost curve only in terms of the spending. I think, and I sincerely believe this, the only way we're really going to bend that cost curve is pushing more of this upstream by keeping people healthy in the first place, starting with kids and adults, community-based, clinical-based, workplace-based wellness programs. So I asked my friend from Utah to look at that part of the bill.
Mr. President, if I can reclaim my 2 minutes and respond to the senator from Iowa, I can give you data that indicates that it's not just the fact that there are a lot of people who don't smoke and don't drink in Utah that's the result that they're healthier. I agree that there are many things in this bill that promote wellness, and I approve of that. But the fact is that the bill does not go anywhere near far enough in this direction to change the paradigm that has created the situation in which we find ourselves. And every expert that I have talked to in the 3.5 years I've immersed myself in this issue has repeated that, has said that. They said the only way you're going to deal with this is to do something dramatically different, which is what Senator Wyden and I tried to do, and we got cold-shouldered. All right, I understand. If you don't have the votes, you can't get anywhere. But the fact remains, we are not going to be able to afford all of the things we want to do in this country, militarily and otherwise, in the cost projection that we are on with respect to health care right now. My time is gone. So.
Senator has used 10 minutes.
That's right. My time is gone. I'll be happy to respond to the senator from Montana if he wants to take the time and let me.
If I might, just for a couple of minutes, proceed, just maybe 3 minutes.
Senator from Montana is recognized for 3 minutes.
I understand what Senator's saying, and like everything around here, there's a kernel of truth in most everything. It is true that healthcare expenditures are going to go. I read that Samuelson article, and what I took away from that article was the guy's kind of pessimistic. There's not a lot you can do. It's just people love healthcare. They're going to get all the healthcare they want, and that's just going to drive up spending. But the main point is this. You mentioned Intermountain and how quality care is so good at Intermountain, and the costs are down.
May, Mr. President, it's not just Intermountain. There are other agencies in Utah that do a good job.
It's Intermountain. There are many other integrated. They're basically integrated systems, and there's one in Billings, Montana. It's called the Billings Clinic. There are lots of integrated systems, and generally, in these areas, these integrated systems, which I think work quite well, a lot of doctors are salaried. A lot of them, the incentives are there to focus on health care, on the patient. It's coordinated care, in contrast with some other parts of the country. And in this bill, in addition to wellness and prevention, I was asking the Senator if he agrees. He said the delivery system reforms will help move in the way provide health care that Intermountain and other integrated systems are. Namely, it encourage coordinated care, they encourage bundling, they encourage these accountable care organizations and so forth. And I was wondering if the Senator thinks that will help systems, clinics, doctors, hospitals, nursing homes, and healthcare providers generally to work better together, where there may be more salaried physicians than currently. But the salaried physicians I talked to at Mayo Clinic, for example, and Kaiser and other places, similar places, that they kind of like that because they get decent salaries and they're able to spend their time not on paperwork, not a lot of stuff, but can focus on the patient. So I'm sure the Senator knows all the delivery system reforms are in this legislation to help move in the Intermountain direction. I'm just asking him, do you think that'll help?
Mr. President, responding to the question from the senator from Montana, I'm delighted that there is as much of that in the bill as there is. But I still believe that the basic structure of the bill is fatally flawed because it perpetuates the present system in ways that will guarantee that the cost curve will continue to go up. I disagree with him about Samuelson's article. I don't think he's being overly pessimistic. I think he's being very realistic.
I might say, just have one more minute, Mr. President, that's this. I understand the bill that you and Senator Wyden co-sponsored, and it's basically to move us away from employer-based system. Where currently our tax law encourages employers provide tax-free health insurance and so forth, and I understand the theoretical and actual problems with our current system. In fact, I earlier advocated moving that direction, not all the way of your legislation, but as you know, this town, this city, this country, this White House just wasn't moving, and major business just would not move in that direction, so that we therefore had to find something else. My main point is, if we can't go in that direction, you might say, well, let's keep trying, but I think if you read the tea leaves, we can't do that certainly now. Isn't it better just to at least start moving toward these integrated systems with delivery system reforms in this bill?
Mr. President, I certainly hope that this legislation will surprise me by producing the result that the senator from Montana is hoping for.
I like your answer. Thank you.
I am not going to hold my breath, however.
Mr. President, I yield. Well, no, this is jump ball, so why don't you go ahead. 10 minutes for Senator Vermont.